It is so exciting. I've had laser eye surgery because in the last few years, the technology has just, advanced so much to make laser eye surgery incredibly safe and incredibly effective at, achieving perfect vision. So, nowadays, I'm an expert in SMILE, which is small incision laser eye surgery, which only involves like a 2 millimeter incision. But also, I can do LASIK, which is the traditional form of laser eye surgery, PRK, which is surface laser eye surgery, as well as ICL surgery, which is implantable polymer lenses. And that's for patients with high myopia or patients who do not have the ability to undergo laser eye surgery. They can have a lens inserted in front of their natural lens to correct their myopia and be glasses free. So there are so many different types of procedures that we can do to treat myopia now to allow patients to be glasses free from the age of 18 onwards if their prescription is stable.
What about I think it's called refractive lens exchange, where you actually
Mm.
replacing the crystalline lens in the eye.
Yeah,
Is that also an option for somebody with myopia?
absolutely. So in older patients, so I would say from like 40 and above, 50 and above,
Mm.
and definitely from 60 and above. So from 60 onwards, I wouldn't be recommending laser eye surgery. I'd be recommending clear lens exchange, which basically involves removing the natural lens of the patient and putting in a lens that corrects their myopia. We've got a lot of like technology now, including multifocal lenses, extended depth of focus lenses, and also you can also try a bit of monovision to be glasses free. It's the same as cataract surgery, but in these patients, they don't really have significant cataracts. We're mainly doing the surgery to allow them to be glasses free, and it has great outcomes as well. Due to, advancements in cataract surgery and the advancements in the type of lenses we have on the market, you know, this area is also, becoming really popular, and, I'm getting really good outcomes with my patients with these technologies.
One thing I'm a little bit confused about is like, why would somebody choose an implantable Collamer lens, an ICL, versus just replacing the
Oh,
crystalline lens, the refractive lens exchange. So in both
yeah,
cases, you're doing some kind of eye surgery. So in
yeah.
my mind, I'm thinking like, why would I choose implantable Collamer lenses when there's also the other option, which is maybe going to prevent me from getting cataracts at some point?
Yeah, it's basically due to accommodation. So before the age of 60, there is the eye still can accommodate. So the natural lens can still focus at near. And so these are younger patients that I recommend have implantable Collamer lenses because then they will have perfect distance vision as well as perfect near vision because they'll be accommodating and their natural lens will be doing that. Over the age of, 60, all accommodation is lost in the eye. So the patient has no ability to focus at near. At that point, having a multifocal lens is perfect because it gives them that ability to focus at near that they would not get with an ICL surgery. And it's
Mm.
also important to know that, obviously the lenses like multifocal lenses, extended depth of focus lenses allow patients to be more glasses free, but they do have some visual aberrations at night, especially like glare and halos. So naturally, if the patient is younger and they still have their accommodation, I would use an implantable Collamer lens because it gives them the best clarity of vision for all focal points. And it also is reversible as well. So if this young patient has decided, oh, I don't really like this ICL, it can be removed and they can return back to their old self. That eye can return back to normal. Whereas if you've done, clear lens exchange, you're committed to having, a new lens basically. So these are all things that's important to discuss with the patients.
Okay. All right. Okay. Now that those are good points. So basically, Linda, you're saying it's never too late for us adults then.
Anyone can have surgery to get rid of their glasses, basically. We have all these different types of surgeries and it's never too late. That's what I get. A lot of people say, I'm too old for laser. And it's important to know you don't have to have laser. There are other options if you don't want to wear glasses. Like Presbyond is now, a laser between 40 and 60 to help get rid of reading glasses. So, people don't even know that. So it's one of those things that, the more that technology improves, the more we can do to, allow people glasses freedom.
Yeah, it's a really exciting time to be an ophthalmic
Mm.
surgeon, I imagine.
Mm. Absolutely.
Well, so Linda, I think this has been incredibly helpful, especially for parents who may be feeling a bit overwhelmed or unsure about where to start with managing the health of their children's eyes. And before we finish, I just want to mention that Dr. Zheng also speaks Mandarin fluently. Is that right?
对，我可以讲普通话。如果你们需要我在做门诊的时候，可以跟你们讲普通话。
I'm going to have to guess what that means, but thank
Yeah,
you.
yeah, I can do
uh,
an entire consultation in Mandarin if
Great.
needed. So just to make the patients comfortable, I've also performed my laser eye surgery in Mandarin. So a lot of my patients, because they're Asian in background and they have myopia, sometimes having their native language is more comfortable when they're having surgery.